And this is where we start. President Cyril Ramaphosa is impressed with Mpumalanga's strategy to combat the spread of COVID-19. Touring the province today, he said people need to continue adhering to lockdown regulations as the infection rate is expected to increase. Mpumalanga has recorded nearly 1,500 coronavirus cases. 520 patients have recovered while 7 have died. Mpumalanga Premier Siphephile attributes the low infection rate to the strategy adopted by that province. This focuses on prevention, detecting and managing infections, while teams have been established in municipalities to deal with infections at a ward level. All right, so as we indicated, that particular province recording nearly 1,500 COVID-19 cases. On that tour with the president, SABC reporter Siphephile Kunene was there. Very good evening to you, Siphephile. Thanks indeed for your time. So it clearly seems that the president was generally impressed with the overall assessment that he did of the province's efforts. Tell us what he said.
The president basically said he's happy with what's happening in the province. The numbers appear to be manageable, as well as the fact that some of the cases in terms of recovering from coronavirus, it has become high, and the way in which the death rate is low is giving the president the impression the province is in control of the infection. They have employed strategies that have to on the ground. They are attacking the infections at grassroots levels. They have established teams in all municipalities, teams that will look into each ward as to what's happening in terms of the coronavirus infections. If someone is found to have the virus, they are immediately taken to the clinic. And if they are above the clinic level, they are taken to a district hospital where they'll be fully attended. And those who need to be quarantined now are supposed to move away from the community and be quarantined on their own. The province is advocating for no self-quarantine at the moment. They want people to be quarantined elsewhere, a place that has been designated for quarantine by the province. Therefore, the president wanted that to be replicated in other provinces, that let's attack it on the ground and move upwards. And he's also impressed that the province has everything in place in terms of preparations for burial, in terms of burying people who will die maybe in high numbers of this disease, but have to be buried in a dignified manner. All municipalities seem to be prepared in the provinces, as well as the economic factor to it. Yeah. The province mostly farms, so they dwell in agriculture for part of the economy. They also do tourism. There's also mining. Therefore, all those are in place right now to start post-COVID. That all impressed the president, Zelda.
Yeah, so Siphephile, I guess though some of the concerns also is infections amongst health care workers in the province and schools. What did the president have to say about that? Those seem to be two of the major concerns within the Mpumalanga province.
Sorry, Griselda, could you please repeat the question?
Siphephile, I was saying part of the concern, though, seemed to be infections amongst healthcare workers as well as infections at schools. What did the province have to say about that to the president on how they're going to tackle some of those concerns?
The program in terms of tackling that is the normal one, whereby as soon as the case is discovered in a particular school, there's a team that's already in place in the province that quickly goes and attend to that particular school, and they trace all the primary contacts as well as everyone around the area who has been in contact with that given case. For instance, at Lowveld High in Nelspruit, Mbombela now, when it was discovered that there's a teacher who has the virus, all those who had been in contact with her, they were all summoned and they were all tested. Fortunately enough, learners had not started classes. Therefore, there wasn't much interaction with them. Therefore, all those who were discovered after the teacher, it's because of the team that's on the ground that takes over as soon as a case is discovered. Now we move on to places like clinics. A number of clinics are being closed in the province, Nkomazi, Emalahleni, and here in Bombela, because the numbers seem to be high in those places. Therefore, when they find a health worker that happens to have that disease, everyone who had been in contact with that particular health worker is called in, because there's a register where you register when you attend a clinic these days, and they can follow up on all those. And lucky enough, most of the clients that attend these clinics and hospitals these days, they register and they leave their numbers. So it's easy to trace them. Now, with one of the biggest hospitals in the province, Temba Hospital, experiencing a surge in terms of health workers that have coronavirus, that has become a norm. Therefore, the province has that in place. They follow up as soon as they discover, just to make sure that they discover the cases in time, so that people can get help and they don't get to the stage of sickness. You'd remember, Griselda, that now the province has 9 deaths, has 9 people who have been confirmed to be dead due to coronavirus, due to COVID-19. Therefore, all those deaths could have been prevented had people adhered to the fact that when you feel these symptoms, immediately go get tested and find out. And what's saddening is that the vulnerable group among those is only 2 people. All the 9 is the youth, which means people are sort of not following the precautions in a way that they're supposed to. Now, the government can only go so far. The Department of Health have been all over the province. They've been visiting mines. They've been visiting all farms. They've also been visiting malls to make sure that there's adherence. The week before last, the Department of Health, through its MEC Sasekani Manzini, launched a home-based, a clinical-based, a community-based kind of approach to COVID-19. Now, if people can go as far as your home to check if you do have the virus and try to help you as the government, what else can they do besides that? Therefore, it's among us as people in Mpumalanga to ensure that we adhere to all the regulations so that we are safe. When you discover these symptoms, it's essentially self-essence. It's important that you report to your nearest health center. Those are the plans that they are using to combat the disease.
Siphephile, and I guess that would be the message throughout the country for some sort of behavioral change if we're going to combat this virus, certainly of concern to government, raising it a number of times over the past couple of days. Thank you very much indeed, SABC reporter Siphephile Kunene in Mpumalanga, there for us, the president, of course, in that province, to check on that particular area's a plan in terms of continuing to curb the spread of the coronavirus. Let's come here.